Hi, everyone. We're back here with FemHealth and Dr. Kim Thornton. She is a REI specialist with RMA of New York, and we're going to be talking about skipping IUI and going straight to IVF. So, Dr. Thornton, thanks for being here. When I was struggling to get pregnant myself, and I had gone through some fertility evaluation as well as testing, and I was told by some friends, just skip IUI. Don't even do the intrauterine insemination. Just go straight to IVF. I was 36 at the time, and I kind of didn't fully understand that I ended up getting pregnant naturally. So I never had to really fully go through with that conversation, but very curious to know your thoughts on what that means and why someone might say that to someone else.
I think it really depends on the couple and the person and their goals and their testing on whether you should skip IUI and go straight to IVF or not. And so there are certain circumstances where you need to go to IVF. So if both of your fallopian tubes are blocked, that's the pathway that connects the eggs and sperm from getting together. So if we're putting the sperm at the top of the uterus, which is what we do with IUI, but the tubes are blocked, we're wasting time. And sometimes the sperm parameters can be so low that we need IVF, or we actually can cherry pick and pick out the best shaped sperm that's moving and swimming and put it directly into the egg. And so those are like clear-cut reasons why somebody needs to go directly to IVF. But outside of those situations, a lot of times IUI is a viable option. But sometimes patients choose to go directly to IVF, and I'd actually say it's probably happening more common these days than I would even say like 6 years ago when I was doing this. And I would say the number one reason people choose to skip IUI is often women who know they want more than one child and maybe starting their first child at the age of 35 or above. And so a lot of times it's a conversation to have is, yes, this treatment may work for you now, but depending on how many children you want, you're going to be pregnant for 9 months and then you're going to deliver. And then most people, we recommend wait at least a year postpartum. And even if you wait a year, that's like you have a 1-year-old and you're ready to jump on in again. And so it's usually at least 2 years when you're like starting to try to get pregnant before you're even thinking about baby number 2. And so if that's something really important, let's say someone's 37 and wants more than one child, well, that might be 39, 40 for that second child, or, even older. So those are a lot of reasons why I have a lot of women who go directly to IVF that are like, I don't want to have to worry about struggling. That's going to be a much harder treatment for me down the road. If I can have some extra embryos frozen to use, then that's going to, help me out. This is going to make a lot of sense. Now, that may not necessarily be the same for somebody who is 29 and wants 2 children, or somebody who only wants 1 child, because we can try IUI for a couple of months or cycles. Yes, if it doesn't work, we can always move on to IVF. We don't want to be doing it for years and years if it's not working, but it's reasonable to give a trial of it and see if it works.
Yeah, I've heard this term a lot, banking embryos, and I heard it when I was in multiple Facebook groups with other women who were going on the same journey as me at the time, and it was kind of the concept of like banking embryos, so you have this basically set of embryos that you can use for later, and you don't have to rush into having your second kid, because I had my first at 37 and second at 39, and I can totally imagine that would be very stressful if you were trying to rush into the decision because, you didn't have any embryos saved. And obviously it gets harder and harder to make those embryos as we get older. Any other final words for someone going through the IVF process?
So, I think, it's a very personal decision. Obviously, there's medical reasons why somebody should go straight to IVF, but there's personal reasons and decisions. And I think just being honest with what your goals are, like how you plan to space your pregnancies, and I think being your own advocate. And some people, IVF is the right answer, and some people are not ready for that step. And it's not necessarily a right or wrong. And just trying to keep sane in the whole process would be the best advice I could give anybody, because I think the medicines, the appointments are not fun, but the emotional roller coaster that it puts people through is probably the hardest part of all of it.
Yeah. Thank you so much for your words of wisdom and enlightening us on this topic. I know a lot of people will find this video very helpful. Thanks for being here.